Now we're going to talk about thermoregulation links in other organs of the body that could be tested in board exams like USMLE or NBME. So let's go ahead and get started. First thing, menstrual cycle. After ovulation in luteal phase, that is the last 2 weeks of menstrual cycle, you have increase in progesterone. So basically progesterone increases basal body temperature by 1 degrees Fahrenheit, and so last 2 weeks of menstrual cycle you will have increase in body temperature. And if person is pregnant, you have body temperature stay raised 1 degrees Fahrenheit higher due to the presence of progesterone throughout the pregnancy. And another link you can think of is of restrictive lung disease. You have decreased O2 inhaled in restrictive lung disease. Depressed electron transport chain shuts down, and that cannot produce heat or energy, and that causes patients to become cold. And you'll notice that patients with restrictive lung disease are hypothermic. Next concept is of electron transport chain inhibitors and uncouplers. So inhibitors stop electron transport chain along with blocking oxidative phosphorylation. However, uncouplers don't stop electron transport chain, they only stop the oxidative phosphorylation part, and that leads to hyperthermia, and you'll have the whole profile of that patient in your head with hyperthermia. We have already talked about that in very good detail. Here's a list of electron transport chain inhibitors versus uncouplers, and this could be tested in board exams like NBME, USMLE, COMLEX. So you want to familiarize yourself and get to know this a little bit in detail. So complex 1, you have barbiturates affecting that, you have rotenone, you have NPP, it's a neurotoxin, pericidin is an antibiotic, chlorpromazine. So these are affecting complex 1. You have malonate inhibiting complex 2, antimycin A, dimercaprol, fenformin affecting complex 3. Complex 4 is affected by carbon monoxide, cyanide, chloramphenicol, azides, and hydrogen sulfide. You have complex 5 that is blocked by oligomycin A, specifically F0 subunit of ADPase is where this antibiotic binds to. Something you want to remember. Uncouplers include 2,3-DNP, dinitrophenol. This is used as insecticide, and illegally it's also used as a weight loss supplement. And you may be given a vignette where you have a patient taking a weight loss medication, and it's feeling that person is feeling very hot, hyperthermic, and you want to know what's going on. So you can probably kind of recall that in 2,3-DNP is an ETC uncoupler. So we already talked about thermogenin, free fatty acids, causing uncoupling of oxidative phosphorylation in pretty detail in earlier videos. So you have so this occurs in obese diabetics, baby, Eskimos. These this occurs in uncouplers. Toxins cause uncoupling. You have ethanol, high dose aspirin. They basically inhibit electron transport chain as well, but the way they inhibit is they form pores, and then all this protons start leaking in through the inner mitochondrial membrane, and instead of production of ATP, you have production of heat. I'll talk a little bit more detail in next slide. You have thyroxine, we already talked about, that increases uncoupling. You have exercise, we already talked about, through hormone irisin that is released from muscle, and that causes increase in uncoupling of oxidative phosphorylation. And here's a website I found, had a pretty good mnemonics on there too, so take a look at that as well. So as I mentioned, ethanol, high dose salicylates and damage inner mitochondrial membrane, and they inhibit ETC there, and protons move into the matrix, and that is kind of like uncoupling, and that decreases protons. The decrease in protons causes NADH and FADH to increase their reactions to produce more protons, and that increase in reaction rate produces more heat and causes hyperthermia. Another concept you want to remember is Reye syndrome. Reye syndrome occurs in a kid with a viral infection, specifically influenza B has a high incidence. You give high dose aspirin, that causes increase in uncoupling of oxidative phosphorylation and electron transport chain of liver mitochondria. Heat is generated, and that can also increase, that can cause fever, and the core temperature can rise up to 107 degrees Fahrenheit, and that leads to hyperthermia, rhabdomyolysis, and again you can recall the whole hyperthermia profile as well. So damaged mitochondria affects urea cycle in liver, and liver cannot convert ammonia into urea, so you have increased accumulation of ammonia, specifically in the brain, and ammonia converts in glutamine in brain astrocytes, and this causes osmotic effect and leads to edema in the brain, and brain swells up. That causes increase in intracranial pressure, which leads to encephalopathy. Another manifestation occurring due to increase in ammonia is causing the increase in GABA due to this reaction. Even though alpha ketoglutarate is a little bit decreased in hyperammonemia, however, this reaction can still occur and cause the formation of GABA. And you can recall that anytime you have increase in inhibition, increase in GABA, you will have lethargy, coma, respiratory depression, and vomiting. Damaged mitochondria decreases beta oxidation of fatty acids, and that increases fatty acid. That causes the increase of fatty acid that is left in the hepatocytes that are available at that time for triglyceride formation. So decrease in beta oxidation of fatty acids cause more accumulation of fatty acids, and you'll see microscopic small fat globules accumulate in hepatocytes which do not displace nucleus, and this is known as microvesicular steatosis, and an umbrella term is fatty change of liver, and this leads to liver dysfunction, and more fat accumulation will cause the liver to become yellow, and you'll also see hepatomegaly, but you won't have jaundice along with this. So damaged liver also decreases gluconeogenesis, and in Reye syndrome, another manifestation you'll see is hypoglycemia. So that's all.